Welcome, ladies and gentlemen, to the Americo Miranda Show. I'm your host, Americo Miranda, and today we're going to talk about a very serious topic, and we've got a very special guest that's with us for this show. To our Portuguese community, muito obrigado, minhas senhoras e meus senhores, convosco Americo Miranda, bem-vindos ao Americo Miranda Show. E hoje nós temos um convidado, um senhor doutor, que nos vai falar, portanto, em vários assuntos muito importantes. Portanto, nós vamos ter a entrevista em inglês e eu sei que muitos dos nossos telespectadores compreendem bem a língua. Também um grande abraço para os nossos telespectadores da cidade de Fall River, a vila do Westport, a cidade de New Bedford e também no estado de Rhode Island, em 38 cidades e vilas da cidade, ou portanto do estado de Rhode Island. Sempre bem-vindos e muito obrigado pela sua preferência. Ladies and gentlemen, today we're going to talk about a serious topic, and I'd also like to welcome our viewers from Rhode Island and southeastern Massachusetts, as well as those who watch us in New Haven, Connecticut and San Jose, California. Thank you, and we're going to get on with this show. My guest is a distinguished gentleman, Dr. Claude Curran. And he's involved with the project. He's going to tell us a lot about a very important subject. And we're going to talk mainly about physicians and nurses against tobacco. And I'm going to let him get into the specifics. Dr. Curran, thank you for being on the Americo Miranda Show.
Americo, thanks for inviting me.
I am very happy you're here.
Yeah.
And I know that today we're going to be talking about a very serious topic.
Cool.
Or many topics that are unknown to a lot of our viewership, and that's why we have you on.
Yeah.
Before we begin, if you could tell us a little about your background,
Sure.
so our viewers can get to know you,
Okay.
And then we can get into the details.
Okay. My parents are both from Massachusetts. My father grew up in Boston. My mother grew up in Brockton. After they married, they went out to Idaho, where my older sister Roanne and I were born. My parents were both school teachers. Came back to live in Rhode Island to be near my grandparents, and I grew up in Cranston, and with a lot of Portuguese neighbors who came and saved the neighborhood many years ago. And I went to Catholic High School, LaSalle, in Providence. Then I went to Providence College. I bounced around to URI, Community College of Rhode Island. Eventually went to medical school at the University of Rome in Italy, where I graduated in 1991. I'm married, I have 5 kids, we live in Bristol, and I'm a psychiatrist here in Fall River. I trained at Brown after I went to medical school in Italy, and I was, after I completed my training at Brown, I was invited to Corrigan, to the John Corrigan Mental Health Center here in Fall River, which many people may not know this, but it's part of the Harvard Medical School South Shore program in psychiatry. And Professor Theo Manschreck invited me to come to Fall River as a research fellow. And I've been affiliated with Corrigan and Taunton State Hospital and Cape Cod and Islands Community Mental Health Center since roughly 1998. I've had private practice. I've very, very busy private practice. I've been involved in the treatment of addiction in this area, which is unfortunately, it's a very severe and very difficult to treat problem, and very expensive problem. And so anyway, that's a little bit of my background.
Thank you. We're going to talk about addiction, I presume.
Sure.
I've had various guests on that we talked about problems with alcohol, tobacco, mostly illegal drugs as well. And I always start off the interview by asking them, but what is the root of the problem?
The root of addiction basically is this. All of us as human beings, we are programmed to eventually become lonely, okay? And that's basically the difference between the child and following puberty. Following puberty, before puberty, the child is playing with his toys and has his little friends. But the post-pubertal adolescent teenager basically is lonely and saying, what am I going to do with my life? Will I ever have a relationship? Will I have someone to love me? Will I ever find someone that will love me, that will be with me. Because the root goes back to the first complaint of humanity in the Bible, Americo. Because all day long I treat people, they're depressed, they're anxious, they're traumatized, they're addicted. And so I had to ask myself the question, what was the first complaint of humanity? Well, there it is in Genesis, after God creates Adam, and Adam names the animals and so forth. Mm-hmm. As we're told in Genesis, God says, well, Adam, is everything okay down here? And Adam says, well, gee, Lord, it's beautiful, but I'm lonely. Okay, that's the first complaint. So Adam wakes up to meet Eve, but the problem is this. The problem is that there are chemicals that can short circuit the brain's desire for a relationship with another person. And once the brain is exposed to certain chemicals, their relationship, that addiction, that drug becomes their principal relationship. Now, I didn't know this when I first started practicing in Fall River, but people will come to me and they can't quit tobacco, and they can't quit alcohol, and they can't quit methadone, and they can't quit heroin, and they can't quit OxyContin. And their relationships fail. They lose their job, they neglect their family, they don't care about their kids. The men will rob banks, and the women will rob banks, and the women will prostitute, and even the men will prostitute because they are so depressed and lonely without their drug. And the family, we look at them and we say, oh, you poor thing, you're an addict. But what we don't understand is their whole behavior is now, all their drives are now basically aimed at finding that drug. Because just as you and I breathe oxygen, these people, the oxygen of the addict's brain is whatever drug they're addicted to. Now, I didn't understand this until I got involved in prescribing Suboxone. Okay, one of the most interesting things that have happened to me, but one of the most troublesome activities I've ever been involved with. Suboxone, it's an opiate. You can get high off of it. Some people do, some people don't get high off of it. But nevertheless, the Suboxone is a medicine that will plug into the circuitry of the brain where opiates plug into. So the heroin addict can use Suboxone instead of using heroin. The methadone addict can use methadone can use Suboxone instead of taking methadone. So I'm prescribing this med. Americo, it's a very, very kind of complicated story because I was one of the first docs in Fall River to use this med. When the federal government first let doctors like me prescribe it, they said that we could only treat 30 patients each. Now that didn't make, there's a restriction on access to this medicine. Okay, it's the only medicine in the world it's the only medicine in the United States where doctors actually have to count the number of patients they treat. And that's all politically motivated because Suboxone has the potential to close the methadone clinics and wipe out 80% of the demand for street heroin. Anyway, it's another topic. Well, anyway, I'm prescribing Suboxone, a young man comes in with his girlfriend, and they're engaged to be married, and in the previous 6 months he had discovered OxyContin and spent all his money, everything he owned, $12,000 on OxyContin. So I give him Suboxone. He's clean for a while, he's abstinent, but he's relapsing, going back and forth and going back and forth. And finally, about 6 months after I initially started to treat him, he comes in and he said, look, my girlfriend called off the wedding. I can't get off these things. And I said to him, I said, I don't get it. I said, what's wrong? You know, look at your girlfriend. She was beautiful. And she was here. She was supportive. She didn't shoot you after you spent all your money, all her money, then because they had saved the money to get married. And I said, what is it about these opiates? I said, what would you rather do? Would you rather be with a woman? What's more important to you, love, sex, or your drugs? And he looked at me shaking his head like he was disappointed in me. I didn't get it. He goes, Dr. Curran, OxyContin's way better than sex. And I said, listen, I'm a scientist. You have to quantify it for me. On a scale of 1 to 10, where's OxyContin? He said, 100,000. There's no comparison.
So this fills in a void in their lives.
Well,
obviously.
the thing is, it restructures their drives. It restructures their drives. So I started asking, I've asked probably about 500 or 600 of my patients. I ask my patients strange questions, but it's the only way I can figure out what's going on with them. I've asked all 600 addicted patients to rate love, sex, and drugs. Okay. Love is a big motivator. The sexual urge is a big motivator. And obviously, drug addiction is a big motivator. Basically, the deck is stacked against anybody who gets involved in drugs, because women will tell me, Dr. Curran, this one woman said, for her it was crack cocaine. Dr. Curran, for me it's crack cocaine. Crack is the warmest, fuzziest, most loving feeling I've ever had in my life. It's better than hugging my kids. When there are drugs out there that are more powerful than the male libido and more powerful than the maternal instinct, how does a physician address that problem?
Sure.
But it's not just the opiates. People will tell me, Doc, my cigarette is my best friend. This is the most reliable relationship in my life. Now, the trick is that all of these addicting compounds, whether it's nicotine or alcohol or Dunkin' Donuts coffee, caffeine, or OxyContin, Percocet, Vicodin, they all trick the brain. Now, if you ever wonder why people, let's go to nicotine just for a little bit, okay? Because nicotine is the introductory drug. The easiest way, or the most understandable way for me to explain to you what nicotine addiction is like is by comparing it to salt. For those of us who have no addictions, most of us put salt on our food. And why? Because salt somehow, and I've studied this and no one really has unraveled this yet, when we put salt on our food, when we eat French fries at McDonald's without salt on them, you really can't eat them. They're really, I don't find them palatable, sure. Unsalted French fries. Sure. But if you put salt on it, all of a sudden, the sensitivity of your olfactory system is just amplified.
Absolutely.
And all of a sudden, so I kind of reflexively salt all my food, okay? So what does that have to do with nicotine? Well, just as salt amplifies our sensation of taste, people who are addicted to nicotine can't feel their own happy chemicals. They get up in the morning, they're kind of irritable because they don't feel their own serotonin and norepinephrine and glutamate or whatever other neurotransmitters in their brain. But when they have nicotine, boom, all of a sudden, because I've asked my heroin addict patients, what's the first thing you do after you shoot heroin, after you inject heroin in your vein? And they'll tell me, the first thing I do, I smoke a cigarette. I say, why? You just injected $120 worth of heroin in your vein. Why do you need a 35-cent cigarette? They say, I don't feel it. I can't feel it. It makes it kick in. Alcoholics will tell me while they drink, they need a cigarette. Okay? People who smoke after they, now I'm going to talk about a few biological processes here. People who smoke after they pee, after they move their bowels, after they have sex, after they eat. And I say, why? Well, because I don't feel the feeling unless I have the nicotine. And the tobacco companies know this. The tobacco companies know that people who smoke don't feel their own chemicals, that everything is bland to them. They have to have that chemical. Now, it's not just nicotine in tobacco. There's an antidepressant called Harmon, and it's an interesting medicine because it's an interesting antidepressant because it works by the mechanism of making your own happy chemicals last longer. That's why after you eat and the body rewards you with that feeling of being full, you smoke a cigarette, you get the nicotine for stimulation, and the Harmon makes that happy chemical last longer. Mm-hmm. The same thing with all those biological activities. Every time we do a biological function, we eat, we remove waste from our body, the body rewards us for taking care of it with a sensation of relief. But people who smoke can't feel that unless they smoke nicotine. So they will smoke all day long. People even, in fact, Roger Bosch and I over at Corrigan, we're doing research now on that, the sensation of cleanliness. After you take a shower, everyone feels refreshed. Where does that come from? But smokers will smoke after they take a shower in order that they can feel that. Now the problem with that, now look, I don't have any problem with nicotine and harm elevating people's moods. The problem is that tobacco kills us. Tobacco kills 1,200 Americans every day. 6 million people die worldwide because of because tobacco caused disease. And that's part of my Project 11, which we'll get to through Physicians and Nurses Against Tobacco. But the hospital system, the healthcare corporations could not function without tobacco. $500 million every day of the year go into the coffers of the American healthcare system because people smoke. And I'm fed up with it, because I'm fed up with people coming into my office. They are helplessly addicted to this chemical. And I have patients that are helplessly addicted to Percocet and Vicodin and Prozac and Paxil and Effexor and all sorts of medicines. But I don't make them smoke those chemicals. The tobacco companies know this. They make these poor smokers smoke this stuff or chew it. And there's just something intrinsically dangerous about the tobacco plant. People who...
So the tax on tobacco that the government is taxing on each pack of cigarettes, this is going back into the health field?
No, it doesn't. I think it's roughly $20 billion. This is an interesting statistic. The entire tobacco crop in the United States is only worth about $2 billion. We could buy all of the tobacco for $2 billion and dump it in the ocean. But the tax gathered on tobacco is roughly $20 billion. The states are really dependent on the tobacco tax, and I think it's a tax on disabled people. My patients will tell me, Dr. Curran, I don't care if it costs $300 a pack. I have to smoke. My brain doesn't work without that stuff. The annual doctor bill is somewhere upwards of $200 billion a year. $200 billion a year to correct the damage of a $2 billion industry.
All the secondary effects.
Well, look at that, but you know, there are so many hands in this pot. Pension funds like tobacco, because if you're 58 years old and drop dead after smoking 2 packs of cigarettes a day for 30 years, the pension fund doesn't have to. It only pays your wife a percentage of your pension. They get to pocket the rest. And none of the, Americo, as you know, I tried to be an independent candidate for Congress in this election cycle.
Yes, and that was in the 4th district?
In the 9th district.
In the 9th district.
In the 9th district. And we collected over 11,000 signatures. We had 2,452 signatures, I believe, verified by the Secretary of State's office here in Fall River. But when they sent them to William Galvin's office in Boston, William Galvin disqualified me.
Now, at the time, were you a resident of Fall River?
Well, yeah, no, it was all. I mean, everything was up to snuff. These signatures have been verified by all the electors and registrars and every 9th congressional district, town, or city, from Acushnet to Wareham, and the professional staff at the Fall River Secretary of State's office. They verified the signatures and gave me receipts for them. They gave me back the sheets that they found were illegible. Anything that was questionable, they handed them back to me or my volunteers. But when they went to Secretary of State William Galvin's office, he disqualified me.
And what was the reason?
Well, the reason is that's being investigated right now. It's difficult to find a lawyer in Massachusetts who wants to go up against the Democratic Party. But I'm very upset about this, because I've been fighting addiction. I've been trying to get addicts better in Massachusetts for the last 15 years, and I can't get them better. But I see everybody making money on the backs of the addict, from the taxi cab driver who drives the methadone patients to and from the methadone clinic every morning, 365 days a year, all on the dime of the public. The detox and rehab centers, where I had one patient who was detoxed 251 times before she eventually became sober. All this burden caused by the pharmaceutical companies that make the addicting compounds, of course the drug dealers. It's a mess, Americo, and that's why I try to run for Congress. I may try again in another 2 years, but in the meantime, I have to spread this word. Americo, when I was out collecting signatures, now here I am, I work all day long, I do call at various hospitals at night. My spare time, I'm out there collecting signatures, talking about the drug problem. Americo, it was very discouraging to learn how vast the drug problem is in Massachusetts. This is a little fun fact.
How does it differ from Rhode Island?
Is there? I don't know much about the drug problem in Rhode Island, but in Little Bristol, I'll tell you that in the last 5 or 6 years, I've lost probably a dozen young adult patients addicted to OxyContin or Vicodin. It's Americo. In the last 10 years, this is just to give you a comparison. In the last 10 years, Massachusetts has lost approximately 120 soldiers on 2 battlefronts over in Iraq and Afghanistan. In that same 10, 11-year period, there have been over 12,000 drug-related deaths in Massachusetts. That's more than 3 a day. During the Vietnam War, during the war in Iraq, when George Bush was president, the media was bombarding us every night with photographs, with pictures of these young soldiers killed every day, 3 or 4 soldiers killed every day, it seemed. In Massachusetts, we have these drug overdose deaths, and no one says anything. When I was out collecting signatures, this young man came up to me, middle-aged guy comes up to me, he goes, we're talking about the drug problem. He said, Dr. Curran, my younger brother just went to his 15th high school reunion at Everett High School. He said 15 years ago, approximately 450 kids graduated. He said, you know how many kids are still alive after 15 years? 219. That's over half the graduating class dead from drug overdoses. I have patients that tell me 10, 20, 30 of their friends dead from drug overdoses, and no one says anything. Why? Because it's so lucrative to treat this problem, and the pharmaceutical companies that make the OxyContin, Percocet, Vicodin, they're politically connected. They're politically connected. Eric Holder, the current Attorney General, used to be the defense lawyer for Purdue Pharma, the manufacturer of OxyContin. And if you get on the website of OxyContin, of Purdue Pharma, right now you will see a link to Giuliani and Associates, because now Rudy Giuliani, a powerful Republican, is their new lawyer, while Eric Holder is Attorney General of the United States. This is how ingrained this problem is. These chemicals are neurotoxins. There's research going on that is now demonstrated in the brains of cocaine addicts, the subcellular damage that's caused in the chromosomes of people that use cocaine. There's no such smoking gun yet that I've been able to identify on people who use OxyContin, Percocet, and Vicodin, but their addiction is just as powerful. When these lesions, when these neurological lesions in the brain are finally identified, all of these pharmaceutical companies are going to be basically liable for this. In fact,
and yet, who will hold them accountable?
That's one of the problems. That's one of the problems. When I fill out disability forms right now, okay, and that's for all the social workers in Massachusetts, all the psychiatrists, all the other people involved in healthcare who fill out disability forms, the last question on the disability form is, would Paul be disabled regardless of his substance abuse problem? Okay, now when I look at Paul's history, Paul started smoking pot when he was 14, started drinking alcohol and snorting cocaine when he was 17, ended up on methadone and heroin and perks and Vikes and Oxys for the last 10 years, has been in and out of jail. If I say, no, the main cause of his disability is substance abuse, they will not give him disability. I have to say, no, Paul has bipolar disorder. That's the main reason that he's disabled. I know that it's not the truth. They know that it's not the truth. But I don't know, Americo, exactly why. But I'm suspicious that would make the either Budweiser and Seagram 7 and the pharmaceutical companies liable for not giving the people enough information on the proper use of alcohol and the proper use of their pain meds.
Very interesting. We talk about the drug problem in school, starting in the middle school. From your experience as a doctor over the years, what is bringing our children, what is introducing, or who is introducing our children to the drugs in the first place?
I don't know, Americo, but I'm very suspicious. Right now, we've been in Afghanistan for the last 10, 11 years. 92 of the world's supply of heroin continues to come from Afghanistan. Right before George Bush left office, and Americo, I'm more conservative than liberal, so
That's a good thing.
yeah. Okay. So so I was concerned about this. Well, anyway, right before George Bush left office, I read in the paper that the Marines had intercepted a shipment of heroin that was being shipped out of Afghanistan. So they confiscated it. Apparently, President Karzai's brother called President Karzai and asked him to call President Bush, and President Bush basically, gave way to that pressure, and he ordered the Marines to release that shipment. That's one of the problems with the restriction on Suboxone, the medicine that keeps people off heroin. Listen, right now, our troops in Afghanistan are being shot at by rocket-propelled grenades and being blown up by roadside bombs that are essentially being paid for by the heroin addicts in Brockton, Fall River, New Bedford, and all over the United States. And that's why I think it's treasonous that the FDA would put restriction on who can prescribe Suboxone. Nurse practitioners can't prescribe it, physician's assistants can't prescribe it, and also why the FDA would put a restriction on the number of patients that doctors like me can treat. Initially, when it first came out, there was a 30-patient cap. I protested that in Boston and was in contact with Senator Kennedy's office at the time. We screamed loud enough to make Senator Kennedy and John Kerry nervous, and within 5 months, they had that patient cap lifted and raised to 100. But nevertheless, what do you do? I asked the DEA, what do I do with the 700 heroin-addicted patients that I have?
Dr. Curran, our show has come to an end. 30 minutes fly by, and it seems we could do a series of talks on this because this is informative. Is there anything within the last 15 to 20 seconds you would like our community to know to summarize what we just spoke about? But like I said, in a very short period of time.
Sure. Okay. The drug problem is real. These changes can be permanent. Okay. Those permanent changes are exploited by the drug companies, by the methadone clinics, by the drug dealers. It's a shame when I see especially the Portuguese community, hardworking, very, very industrious people, and I'll see a young guy, 30, 35 years old, addicted to Percocet and OxyContin, and half of his paycheck, half of his children's opportunity are going to the drug dealers. We have to get real about the drug problem. Basically, we have to allow access to these medicines to people who are addicted without making them rely on the drug dealers to supply them.
Absolutely. Dr. Curran, thank you so much for appearing on my show.
Thank you, Americo.
And in the future, let's have a follow-up because I know there's a lot to be said, but at least we got the introduction done today.
Great, thank you. Thank you.
Ladies and gentlemen, my guest today, Dr. Claude Curran. I hope you enjoy the introduction. We spoke about a lot of serious topics. Addiction, deadly addiction, destroys people's lives, destroys families, can destroy our society. Until the next time, God bless, stay safe.